Now let's dive deep in about our number one biomarker, which is diagnostic biomarkers. These biomarkers can help us confirm if we have a specific disease or not. Let us walk through an example with three different specific diseases. One, celiac disease. Number two, IBS. And number three, IBD. Let's talk about celiac disease. So first of all, celiac disease is an autoimmune condition where ingestion of a gluten leads to damage in the small intestine. And identifying celiac disease early is crucial for managing symptoms and preventing complications. So there are two biomarkers I can explain here. One is tissue transglutaminase and B, endomysial antibodies. So these biomarkers are measured through a blood test. A healthcare professional will draw a small sample of blood, which is then analyzed in a laboratory for the presence of these antibodies. If there are elevated levels of tissue transglutaminase and endomysial antibodies, then it can confirm that it's celiac disease. Whereas in the absence of these antibodies, it is easy to diagnose that the celiac disease doesn't exist. And for patients who have positive signals, then it can be sent for intestinal biopsy to confirm the diagnosis. So this is how a simple biomarker test can be used to confirm whether someone has celiac disease or not. Now let's talk about IBD before IBS, because the biomarkers we measure for IBD will also be useful for IBS diagnosis. So inflammatory bowel disease includes Crohn's disease and ulcerative colitis, which are inflammatory conditions of the gastrointestinal tract. And obviously, accurate diagnosis is essential for effective management. So there are three biomarkers measured. One, fecal calprotectin. Two, C-reactive protein. Three, erythrocyte sedimentation rate. Fecal calprotectin test is taken through a stool sample, and CRP and ESR, C-reactive protein erythrocyte sedimentation rate, ESR, is measured through blood test. And when high levels of fecal calprotectin mean indicate inflammation in intestines, suggesting IBD, and elevated levels of CRP and ESR indicate systemic inflammation, which is common in IBD. So high fecal calprotectin levels combined with elevated CRP and ESR are strong indicators of IBD. And obviously, these patients should undergo diagnostic procedures such as colonoscopy or biopsy to confirm the diagnosis. And here is where the normal levels of fecal calprotectin or CRP and ESR suggest that IBD is unlikely and other causes of symptoms should be considered. This is when the difference between IBD and IBS. IBD can be measured through these biomarkers and help to diagnose using it. But IBS, we do not know the real cause of it. And also, there aren't biomarkers to diagnose IBS with constipation or diarrhea or mixed. It is diagnosed through the ROM4 and through consultations with the gastroenterologist. So, absence of fecal calprotectin, CRP, and ESR can confirm the absence of IBD. What I mean by is low levels of it can confirm the absence of IBD, whereas it opens door for the possibility of IBS, and IBS using ROM4 criteria, such as the symptoms, such as the triggers, such as the bowel movement trackers, the visual indicators, and the severity of symptoms. The gastroenterologist will, using their judgment, will diagnose the IBS. So that's the difference between IBD and IBS using the biomarkers.